Hi, my name's Claudette, and a little more than 8 years ago, I was struggling with fatigue, poor sleep, weight gain, heartburn, dry, thinning hair, cracked heels, and overall poor mood. My doctors had told me for decades that my thyroid was in the low normal range, but still normal. I knew something was wrong with my metabolism, so I spent some time researching online and finally came across the Optimal Thyroid program. A couple things struck me. First of all, the program is telephonic, so I could talk to my health professional while at work, in the car, or at home in my sweats. I have a direct contact with a physician, with no office staff in between, who takes a unique, in-depth, and thorough view of my thyroid function through advanced testing and an uncommon treatment methodology. My experience with Optimal Thyroid offered a 5-step process. First, discovery, where we went through my lab work to design my plan. Second, adjustment, where my plan was tweaked in conjunction with my symptoms. Third, stability, where I continued with the adjustments that had been determined. Fourth, optimization, where I headed to my personal treatment maximization. And fifth, maintenance to continue with the crafted plan. All of this starts with a complimentary consultation. You are actually able to speak with an Optimal Thyroid Program medical provider for free for approximately 15 to 20 minutes to discuss your concerns about your symptoms and be advised as to what the program can, or in some cases, cannot offer you. Once I decided to move forward, we began with an extensive order of lab tests, including some that I had never had before, such as testing for Hashimoto's disease, a disorder in which your immune system attacks your thyroid. And I did indeed find that I had the disorder. About 3 weeks after the blood draw, I had the initial phone consult with my physician, and we began a unique treatment plan based on those results and my symptoms. I began the medication and supplements that she and I decided on together. And about 3 weeks later, I talked to her again, and we made some adjustments based on how I was feeling. I couldn't believe the improvement in my overall well-being. I began losing weight. I no longer needed my CPAP machine to sleep. My mood improved, and my skin, hair, nails, and heels were better. All this happened over the course of about 6 to 8 weeks. The remaining months of the year-long program includes 3 additional blood draws, followed by a consult occurring about every 90 days. With every subsequent blood draw, my doctor and I made assessments and tweaked my program as needed. In those following months, I began to feel even better as I was entering the optimization phase. My body kept getting better at using the medication as we were solidifying the right dosage and frequency. Now I am sure that I'm doing my absolute best. After the initial year, I began a maintenance program with Optimal Thyroid, which involves less blood draws, less visits, and a lower cost per month. That was my choice, but you have other options available to you. You may continue your treatment with Optimal Thyroid as I did. Or bring your information to your PCP, provided he or she would be willing to continue prescribing your medications. Or you may find a new doctor to continue with. This program has been tailored to be accessible, convenient, and reasonable at just $75 a month. That price includes the 5 telephonic physician consults and the 4 blood draws needed to be done to manage this program highly effectively. It's all included for $75 a month. The only additional cost would be any medication and/or supplements as needed. Oftentimes, medications can be covered under one's medical insurance. An attractive aspect of this program is that the risk for you has been removed. The Optimal Thyroid program does not require any long-term contract. If you're not happy with the results you are experiencing, you can stop at any time. But I sincerely encourage you to give the program a few months, because if this program is right for you, you're going to experience significant improvements as I did. Make a commitment to yourself, to your health. Join this program. Spend 90 to 120 days going through at least 2 labs and 3 consults, and see what a difference the Optimal Thyroid program can make in your life. How can you get started? It's as simple as booking your no-risk complimentary consult with a healthcare specialist at Optimal Thyroid, and you can do the booking right now online. It'll be the next step after you close this video. Come join me for a path to a better quality of life.